Hi, everyone. Usually at this time of year, we'd be gathering together to attend cutting-edge scientific sessions, practice-related workshops, and social events at APA convention. Unfortunately, we aren't having a very usual year. But as we're all doing in our professional and personal lives, we're adapting. My name is Zeeshan. It's been my honor to serve as Society President this past year. This address, the President's address, has often been a platform for the President to share their vision for the Society or to reflect on their own careers. In a slight departure, I'll be focusing my talk this year highlighting the dozens of volunteers that make the work of the Society possible. For any organization, a statement of mission helps define its priorities and scope of work. For those of you who may not be familiar with it, the mission for our Society has four primary components: to advance the science of the psychology of health, support evidence-based applications of health psychology, promote competencies-based education and training, and to disseminate health psychology broadly. This mission gets carried out by your Society board and other volunteers who I'll be introducing you to. Your executive committee consists of the elected officers of the Society. The President works closely with both the past President and the President-elect in what we call a presidential trio setup. I had the great fortune this year of sharing trio responsibilities with past President Dr. Nancy Ruddy and our incoming President Dr. Helen Coons, both practical, insightful, and generous leaders, as well as role models. Our executive committee also consists of 3 elected members at large. Annie Bradford was absolutely instrumental this year in leading a task force to explore how the Society can provide continuing education programming for our members. Working with Claire Conley, Teresa Pan, and Peggy Zokola, we've been able to partner with the Society of Clinical Psychology, APA Division 12, to establish a process for this. Stay tuned. This is going to be very exciting for us. Dan Bruns has been an incredible ambassador for the Society on a number of initiatives with outside organizations, such as the American College of Occupational and Environmental Medicine, the American Medical Association, and various government groups. We're grateful for his leadership. John Ruiz has served 2 very important roles for us in the past year. For one, he's been the one to beat a steady drum for us to prioritize and improve our Society's culture of diversity, equity, and inclusion, which recently led to the creation of a new position. More on that later. He's also served as our Society representative to the Behavioral Medicine Research Council, a multi-society health psychology collaborative. Thank you, John. In large part, thanks to your apportionment votes, we continue to have 3 representatives on the APA Council of Representatives. As a reminder, Council is one of the most direct ways for us as health psychologists to have a voice in larger APA governance. We have been very fortunate to have Ron Rosensky, Susan McDaniel, and Rick Simey representing our interests. I also have a lot of gratitude for Barbara Kubik, our treasurer, who's helped us navigate several issues that impact our spending, budget, and our ability to meet an overall fiduciary responsibility to the Society and its members. Our newest member on the executive committee is Tanisha Blue, who recently began her appointment as our first diversity and inclusion officer. In just a few weeks, she has started laying a framework for collaboration and outreach related to diversity and inclusion that will have great impact. Welcome, Tanisha. And I want to introduce you to our leads for committees and councils across the Society. Our convention programming this year was headed up so admirably by Julie Radico. Julie had the unenviable task of turning on a dime when it was announced that APA convention would be going virtual. We hope many of you will seek out the Society programming on the APA convention portal, but also stay tuned on our listservs for announcements about free live events exclusively for members. Jessica Naftali has been a force this year in her leadership of our Student Council. Among the accomplishments of the Student Council include conducting a survey on the impact of COVID-19 on interns and postdocs, which incidentally attracted attention of APAGS, the Graduate Student Group, and the Education Directorate at APA. The curation of resources related to COVID-19, racial justice, and graduate student advocacy, and conducting events and outreach to graduate and undergraduate programs. Thank you to the entire council for your service. Josh Wiley chairs our Early Career Professional Council, which is focused on making sure the society meets the needs and interests of our members who are within 10 years of their doctorate. From all the way in Australia, he's done an admirable job helping ECPs integrate meaningfully into our various councils and committees. In addition to promoting recent research on our listserv, the Health Research Council supports several graduate student research awards, including separate awards to promote inclusion and to address health disparities. Ali Weinstein has done a terrific job chairing the council. We are extremely fortunate to have Lisa Kearney chairing our Clinical Health Services Council. In a short time, the council has surveyed our membership regarding needs related to the practice of health psychology to help guide next steps for the council to develop and promote practical resources to facilitate translation of research to practice and to address business operations for health psychologists. They also have plans to develop a continuing education series, which will likely have wide appeal. Kristen Riley heads up our Health Policy Council. This nimble, rapid response team reviews strategic plans and evidence reviews from the NIH and other national groups, ensuring our best science and expertise is represented. The council is also responsible for considering co-signature on other groups' policy statements and increasingly in the development of society-led briefs. Thank you, Kristen and team. Luz Garcini chairs our Diversity Council. In addition to developing symposia for APA convention and cross-society meetings, the Diversity Council has also been developing ways to increase outreach to potential members that represent the full diversity of health psychology. This is a wonderful team. Our Education and Training Council is spearheaded by Peggy Zokola. In the past year, the council has helped shape our ability to provide continuing education offerings to our members and has developed a repository of syllabi and other resources on health equity and disparities at the undergraduate, graduate, and postgraduate levels. I'm also grateful to Mark Vogel and Rick Saimi for their education and training hats that they've been wearing in the past year. Mark is representative to the Clinical Health Psychology Specialty Council, and Rick for serving as chair of that specialty council through 2019. Thank you both. Kristen Schneider leads a dedicated committee focused on outreach to potential society members, while welcoming our new members and helping to ensure retention of our existing members. This is amazingly done with individual attention to each member, and for that, we're all very grateful. In a similar vein, we have been fortunate to have now President-elect Barbara Anderson as chair of our Fellows Committee to help identify and recognize our members who have made significant impact on our field. Will Tsai helps the society nurture our international ties by creating programming for convention and serving as our liaison to a research award meant to foster opportunities for trainees to do research at international labs. A special thank you goes to Pat Saab and her Nominations and Elections Committee, who help identify candidates for our open elected positions each year. The slates are always incredibly impressive, which speaks to the health of our society. We have a publications and communications dream team chaired by Chris France. Under this umbrella, we have Ken Friedland, editor-in-chief of our flagship journal, Health Psychology, and Val Martinez-Kaigi, editor of our society newsletter, The Health Psychologist. Alex Ski leads an incredible team of tweeters, Facebookers, and LinkedIn posters who help disseminate health psychology relevant news and research. Amy Grinberg will be stepping into that role soon. Claire Conley has not only contributed to our continuing education task force, but also heads up our society teleconference series. Dawn Jewell serves as our website editor and is shepherding us through the process of a complete website overhaul with the help of an outside company. Thank you all. Over the past several years, the Society has supported the development of several affinity groups, which we call interest groups. Think of these as smaller groups within the 3,000 plus member society who have common clinical, research, education, or policy interests. We're fortunate to have 3 such groups currently. An integrated primary care interest group led by Barbara Ward Zimmerman, a pain psychology interest group led by Ravi Prasad, and our newest interest group focused on women's health led by Ellen Polshuk. Thank you all 3 for your leadership. The activity in each of these interest groups is too much for me to summarize well here, but I would encourage you to reach out to these leaders if you would like to learn more. There could be no summary of the Society without mentioning Barbara Keaton, our administrative officer. She is both a large part of the brains and the heart of this great society. But any metaphor I could come up with to explain how vital she is to this organization would come up short. Barbara makes things happen and somehow manages to do it with an enviable amount of grace and diplomacy. Thank you, thank you, thank you. As I wrap up this brief presentation, I'll use some final presidential prerogative, given that we are the society focused on both health and behavior, to remind us all to wash your hands frequently. Maintain at least 6 feet distance from others outside of your quarantine. And to wear masks over your nose and your mouth when distance is impossible. I hope to have the chance to see you all in person sometime soon, and maybe engaging in these behaviors will get us one step closer to it. What is the state of the society? It's incredibly strong. It's incredibly strong because it rests on the shoulders of dozens of volunteer leaders. They are your friends and colleagues, and I'm grateful to have served beside them this year as president of this great society. Thank you. If you haven't yet, you may want to check out the Society website and social media accounts where you can get more information on our activities. I'm also happy to hear from you directly. Thank you.